Governor Abbott has signed Senate Bill 22, which prohibits certain transactions between state and local governments with an abortion provider or affiliate of that provider. Here to talk about this is Sarah Wheat with Planned Parenthood Greater Texas and Nicole Hudgens with Texas Values. Thank you both for being here.
Thank you.
Thank you. So, Nicole, SB 22 supporters say the bill will prevent, quote, sweetheart rent deals like the one the city of Austin and Planned Parenthood agreed on. The law is supposed to go into effect September 1st. What changes will Texans see?
Well, they're going to see that their taxpayer dollars aren't going to organizations that have been accused of selling baby body parts and covering up child sex abuse. You know, Planned Parenthood is a $1.6 billion organization, so if they want to pay for rent, they can pay their fair share. But it's not fair that taxpayers are having to pay hundreds of dollars of increase in their taxes while organizations like Planned Parenthood are getting sweetheart rent deals.
Sarah, what is your response, and what does this mean for Austin's or East Austin's Planned Parenthood?
Sure. Thank you, Rebecca. So first of all, this Planned Parenthood Health Center has been providing preventive health care services. So birth control, including IUDs and implants, HIV tests, STI treatment and testing, treatment for urinary tract infections, cervical cancer screenings, breast cancer screenings. This is basic preventive sexual health care that, particularly for uninsured and low-income women, is a vital and needed health care resource. So we have been in this partnership with the city of Austin. It's been over 40 years now. It has widespread community support. It is a very common arrangement that cities can have with a nonprofit. So we are not unique. Other nonprofits throughout the city also have similar partnerships, and that's because when it is a valuable service that's being provided, such as cervical cancer screenings, STI treatments, HIV tests, clinical breast exams, birth control to help families plan and space their pregnancies, that is a valuable public health to the community, and so that's why we've had this partnership in place for decades now.
Nicole, the East Austin clinic does not perform abortions, so why does it matter if Planned Parenthood closes this particular clinic?
So you're still being associated with this organization that, again, has been accused of covering up selling baby body parts and covering up child sex abuse. But not only that, we're seeing where people in this community have seen their property taxes go up hundreds of dollars, and there are 24 federally qualified healthcare centers in this area that do the exact same thing without the controversy. And so taxpayer dollars aren't going to be used to subsidize controversial organizations, and there's still plenty of places for them to go to get what they need for their health care.
Sarah, opponents of SB 22 say that this is a threat to the health care of low-income Texas residents. Can you talk about that?
Yeah, so I think it's important to note that Planned Parenthood is one of the most trusted providers of reproductive health care in the country. 1 in 5 American women go to a Planned Parenthood Health Center at some point in their lives, and that's true here in Austin, again, where we've been actually part of this community for over 70 years. And so many patients choose to come to Planned Parenthood either because we provide services on a sliding or cost-affordable scale, also because they trust Planned Parenthood when it comes to birth control and what is the very best and latest in preventing STIs and anything that might be sensitive and important to you in terms of your sexual health. Planned Parenthood is a trusted resource for that. So we have been in partnership. It's been approved unanimously and recently by a 10-1 vote by our elected officials here in the community. So we have consistently seen strong community support for this partnership and for the health care services that we provide. And so I think, unfortunately, this bill is really politics at its worst. It's about politics and meeting a political goal versus public health and what do communities choose to do to provide much-needed health care services, particularly to uninsured and low-income women who are the majority of patients that we serve in this location.
Okay. We are out of time, but Sarah, Nicole, thank you both for coming in and sharing your perspectives.
You're welcome. Thank you. Thanks so much.